Hello and welcome to the Third Sector podcast. I'm Lucinda, Rouse.
And I'm Dami, Adewale. Each week we bring you half an hour of discussion and debate about the important goings-on in the charity world. This week we'll be exploring one approach to measuring the cost-effectiveness of charity work and finding out the benefits of applying a more entrepreneurial mindset to charitable programs.
That's right, and we're joined for this discussion in the studio by Ben Williamson, who is the Director of Recruitment at Charity Entrepreneurship, an incubator program that supports the launch of new charities, aiming to bring the best aspects of for-profit innovation to the non-profit sector. Hi, Ben.
Hello.
What does it mean, practically speaking, to take a more entrepreneurial approach to running a charity?
Right. I think there's a few different ways in which you can look at this, but one is being creative in the different programs you might run and how you can be really effective and efficient in running those. So when you have a business, you have to really care about your bottom line and innovate your product to make sure that it's as cheap as possible and as useful as possible to people. And one thing that we try and encourage the charities that we launch at Charity Entrepreneurship to really focus on is being very clear in their end goal. So what the ultimate thing is that they are trying to achieve. Are they trying to increase health outcomes? Are they trying to improve education? What is it that they are most trying to do? And then being very creative and flexible in how they're going to achieve this. So not being wedded to a certain mechanism of improving education, not starting out with the answer of we're going to train teachers to therefore improve education outcomes, but being flexible to consider many different options. And then in doing that, being able to run short tests, being able to model different aspects out and look at lots of different ways in which you might be able to be more efficient in achieving the outcomes that you want.
What is it that really sets this entrepreneurial mindset or approach apart?
One thing might be maybe an almost slightly ruthless focus on costs. As charity workers, we care a lot about the outcomes that we are achieving, making sure that we are really helping people or the beneficiaries of our work. And of course, we care about costs, but mostly we want to make sure that we are helping people. But if we can save those costs, if we can run our programs cheaper, if I can halve the cost of a program that I'm running, I can then reach twice the number of people. And that is what it means to run something more cost effectively. And I think that is really essential to what we're trying to achieve in bringing that for-profit mindset. And so it's having a narrow and defined look at all the different kind of aspects as if you're running a really tight budget in a way that maybe is very common to someone who's running a business and really feels that bottom line, really feels the profit margins. But for a charity, we tend to focus more on the outcomes than on those costs.
So you have some background in entrepreneurship, I understand, both in the for-profit and not-for-profit sector. Could you tell me very briefly about that experience and how you were picking up on a word you said earlier, ruthless, in what you were doing to ensure that you were being cost effective?
Yeah, so before my most recent role, I was the co-founder of a charity called the Maternal Health Initiative. I set this up in 2022. We were delivering improved healthcare in Ghana. So this was like an international development charity, and we were focused on trying to improve access to and knowledge of contraception through the public health service in Ghana. The goal we had there was to improve health outcomes and particularly to improve this knowledge to and access around contraceptives. How we got to that goal was something that we tried to be very creative around and focusing very hard on those costs. So one of our main costs was training healthcare workers. We would train them in the knowledge of lots of different contraceptive models. Often healthcare workers would know one or two methods, but the information that they would have or the information that they would provide is quite incomplete. So we would provide these training sessions. And you get into these very practical, almost logistics-based questions and considerations. So how can we most cheaply train these healthcare workers? Is it cheaper for us to go to each facility and then do a day's training at one healthcare center and then another day's training at another healthcare center? Or in the model that we did, we can bring those healthcare workers to a central location. So it's cheaper for us to actually pay for people to come to a central location and then like pay for a facilitator for just the one day rather than like several days. That's in some ways like very basic, but there are lots of these different costs. Modeling how much fuel it cost for our team to go and visit these different facilities to check up on how the care was going. And then we found that these fuel costs were just really quite prohibitive. That actually fuel is quite expensive when you're working in a lower income country and doing lots of travel, often long hours on roads. These costs were really adding up in our program. And a lot of healthcare workers actually have smartphones. So we were able to actually deliver a lot of follow-up or look at delivering a lot of follow-up digitally through photos, through text messages, these sorts of things, and be able to cut those costs. So in this way, it's about being very ruthless, about looking at those individual line items and seeing, is there a way in which we could cut this down? If I had to reduce this cost by 50%, how would I even start to try and do that? Is there a way in which I could try and achieve that?
Could you talk to us about the differences in applying this approach to direct delivery versus system change programs?
Yeah, the work that I did at Maternal Health Initiative was very direct delivery. And that makes it, I think, in some ways a lot easier. The costs, these line items, are a lot more obvious. And so it's very easy for me to pick out, we had to train these healthcare workers. We had to go and pay the fuel to visit these facilities. And are there ways in which we can find ways of shortcutting this? With direct delivery, it's also a lot easier to understand what your goal is and therefore how well you're achieving this. With systems change, it obviously gets a little bit more complicated in terms of being able to model out exactly what your end goal is and the inputs you need to put in to get there. And maybe the most important idea here is that a bad model is better than no model. So modeling a theory of change for a systems change approach is still going to be difficult. There are going to be uncertainties. You might have to make assumptions, but having that on paper allows you to really understand where those assumptions are, where you have least confidence in your model, and therefore where you might most be able to experiment with trying to save costs or increase effectiveness of your program, because you can see where the pinch points are or the potential leverage points are.
So let's break it down then. If you've got a charity or not-for-profit organization who's got their theory of change and they want to really start thinking about the cost effectiveness element, when they're in the planning stages, what sort of tools do you use or do you recommend that your participating charities in your incubator use to really make sure that that is a core focus in the planning stage?
Maybe the first step that we go through is what we would call just a back of the envelope calculation. And the name speaks for itself, you can literally do this with a pen and paper. And it's then breaking down the most obvious breakdown of what your key costs are, and then what the effect is that you're having, what the impact of your work is. And this is going to be somewhat assumption driven, but you might sit down, say, take the case of the charity that I was running. How much does it cost us to visit a facility? How many facilities are we trying to visit? Therefore, I can start to model what our costs are. And so you can start on that just very high level. Let's just put two numbers down that I think are roughly right, and that gives me a benchmark. I might come back to this and expand break each of those numbers down. So in the cost of each facility to visit, there are several costs that go into this. But for now, for the very first point, it's easiest to just start at that top level. What's my rough estimate of the cost per facility? And then the same on the other side. Is there a program that I can compare or that I'm maybe modeling my work off? And how good is that program? Is there a study that I'm basing my program off? And how much effect did they achieve? Let me use that as a benchmark of the effect, and now I can see both sides, and I can see on a very broad level how cost effective my program is. And one of the most useful things you can do with this at the very high level is just to see which side of this equation you might more easily be able to have leverage on. When I make this model and make these assumptions, does it seem a lot more reasonable to be able to cut some of those costs down, or to find ways to increase the effectiveness of my program? And then in using these calculations, you can model different scenarios. Okay, if we ran this training digitally, rather than going to each healthcare facility, how much would that cost to do? How much cheaper would that be? I'm going to assume that digital training is not as good as being there in person. I can't maybe convey quite the same quality of information. I can't maybe work through examples in the same way live with participants, with the healthcare workers. So I'm going to save these costs, but that's going to reduce my effectiveness somewhat. And I can just, in the same way, with a few assumptions, model this out. Okay, the effectiveness has come down, but I saved the cost somewhat, that this program is twice as cost effective to run. That gives me a starting point to then maybe make the decision to start exploring in more detail what it would look like to run the training digitally. So I'm not going to use this as the final decision point, but doing these sorts of calculations can be a great starting point. It can help you make decisions about which directions you might want to go down.
And then you start actually delivering this project. And I don't want to talk exclusively about direct delivery programs. I've got in my mind, as you've been talking, if you're trying to induce a policy change, for example, and whether you could apply the same approach. So now you've started your activities, you need to keep measuring the cost effectiveness and seeing whether your assumptions previously are correct or not, and sort of adapt accordingly, right?
Yeah. And so maybe to take a policy change example, we had a charity that we launched called the Lead Exposure Elimination Project. And so they were working on producing policy change around exposure to kind of harmful chemicals in household goods, and how you might model how well you're achieving this. You're not going to achieve the policy change on day one, but there are lots of different metrics or staging posts, let's say, that you could use to see if you are actually making progress. So one thing that they use, that we see quite a few of our policy charities use, is the level of engagement that you are having with government. If you know that a certain department or a certain minister is going to be the person who is responsible for producing that change, how well are you engaging with them? And you can measure that even in a simple way of just how many meetings have you had with government officials? How regularly are you meeting with them? Are you producing policy briefs that are used by the government? All of these metrics might be imperfect. There might be good reasons to say that these aren't actually what you care about in the end, and it's important to bear that in mind. But again, there are ways in which you can measure if you are having success in getting closer to achieving policy change. And this is where that theory of change can come in terms of what are those steps along the path that you need to get to actually achieve the policy change that you want. And then how do you know if you're actually moving along this chain?
Mm-hmm. And measuring cost effectiveness as you go.
Yes.
I'm assuming that given the startup nature, most of the charities that you're working with are very small, but can this approach be applied to big beasts of the charity sector? If so, how, and anything that needs to be adapted in order for them to be able to do it?
I'd like to think so. One more difficult aspect of it in a larger organization is maybe smaller organizations have more tolerance for mistakes. When our charities do something that doesn't work out, we try and encourage and celebrate that, because startups have a expectation of some level of failure. We don't expect every single one of these to work out. And I think within larger organizations, there is perhaps a more of a concern or worry about having projects or initiatives that don't work, that you try a new approach to delivering a service and that approach just really isn't useful. And I think in some ways, actually, there's all the more reason to do this when you're a large organization. You're running many different projects, and if you can find efficiencies overall if you can run several experiments and a few of these work out, but they are 3 or 5 times more effective. It's actually very worthwhile also accepting a few failures. That like the net sum of that value is very positive, but I think it can be hard. And so there is a question on kind of managers or decision makers to give teams and individual team members a bit more scope for experimentation and maybe even for making mistakes, for trying things that didn't work out.
Yes, whilst having that cost effectiveness at the forefront, because I'm thinking of the donor relations officer at a charity who has to go back and explain that this quite sizable sum of money that has been donated, thinking, for example, if you're an animal charity, that it's going to go to the good of the animals, and you have to go back and say, oh, I'm really sorry, but that didn't work.
It's tough. And I think when this process is done rigorously in this way, as you suggest, that you have a very clear model of the cost effectiveness. You really understand why you've tried that new approach, that new project. You're not just doing it for the sake of it because you had a little brainstorming session and it seemed a good idea at the time. You have your theory of change, you have your model, you have really good reasons to believe that this approach might be feasible and would be really valuable if it worked out. And I think, maybe optimistically, but I think if you then are the donor relations manager and you then communicate that information, this project didn't work out, but here's why we were really excited about it. Here's why we tried this out. And we really believe that this kind of experimentation will allow us in the coming years to reach a lot more animals. And I think that's the idea here, that ultimately this experimentation is in service of the same goal that donors have. They want to see their donations be used to help as many animals, help as many people as possible. And experimenting with new ways of running programming is in service of this, can actually help make those donations go further, even if it means maybe a few bumps along the road along the way.
And have the people within the charity having the people who are supporting the charity, potentially the people who are also benefiting from the charitable services, to have that higher appetite for risk.
Do you have any tips for charities that would like to try out your approach, and any guidance or resources they can use to help them get started?
Yes, my tip would be in what I was mentioning about back of the envelope calculations, to not allow this to seem like a large area of work that you need to go and study and really learn. To sit down for 5 minutes and just try this out with a very basic set of assumptions and just try it out right now. You need to really understand the nuances of how to do this, that you can go and apply this on a piece of paper. A lot of our charities will use a very simple spreadsheet. We're talking 10 rows or something like this. In terms of resources, we have a book at Charity Entrepreneurship, How to Start a High-Impact Nonprofit. It's a little focused on starting charities, but the resources and guidance in there is very extensive on how to do these things. And I think in this way that we've been talking about, very applicable, even if you're running a project or a department within a much larger organization. There's a lot of takeaways that you can apply. We also produce a lot of research on new charity ideas. When we launch our new charities, we have an in-house research team who investigate new areas where a new charity might be particularly valuable and the intervention that they might go and explore. And so these research reports are all available on our website, and I think a really good practical example of how to go through this. So each of these has a cost effectiveness model. Each of these has a theory of change. And so I think I'd encourage people to look at those as a really concrete example of what it looks like to do this within constraints. It's not a crazy fancy model.
As a final question for you, in the interests of balance, and because the charity sector doesn't tend to appreciate preaching from corporate entities about how to run their organizations, what do you think that for-profit startups can learn from the approach taken by many charities?
I think there's plenty that can be learned on both sides. One thing that businesses can learn a lot better is to care a lot more basically about customers. I think charities really care about the nuances, maybe the big picture of their beneficiaries and the full range of experiences that they have and the ways in which they can be served, and ultimately trying to genuinely improve people's lives. This sounds maybe a little cliche or a little basic, but companies can get maybe a little lost in, they build a new technology, they made a new product, because they believe that this product would actually be useful to the world. And then in the process of building the business and getting more funding and having shareholders, the desire to build something that is genuinely useful to people, that is genuinely improving the world, gets a bit lost in the bottom line, in the profit drive. And I think that a lot of the people who are involved in these like businesses or start these businesses are genuinely motivated about improving the world in a similar way to many charity workers or charitable organizations. But it's much easier for that drift away from maybe what is most appealing to a customer, what is most likely to get them to buy my product, becomes quite different to what is actually building a product that is genuinely useful to people.
Great thoughts there. Ben, it's been great to have you with us. Thank you so much for joining us today.
Thank you.
We hope you enjoyed our discussion about cost effectiveness, and that's it for this episode. We'll be back again next week. But for now, from Dami and me and everyone at Third Sector, thank you so much for listening. Our producer is Jude Owen.